In just about 3 weeks, Indiana's new abortion ban will take effect. That has some doctors worried about a different issue.
OBGYN deserts across the state already make it difficult for pregnant women to get the care they need.
Tonight, our Rachel Krause discovered Indiana's new law could make it even harder.
Data from the Indiana Department of Health shows about a third of Indiana counties don't have a delivery hospital, impacting thousands of women and hitting rural counties the hardest. Dr. Caroline Rouse with IU Health says this makes it harder for pregnant women to get care, especially if something unexpected pops up.
Or in high-risk pregnancies, we're often having to see people as frequently as twice a week, sometimes more. And the burden of travel and time away from work and potentially needing to arrange childcare in order to travel long distances to get to an appointment is a really big deal for a lot of patients.
But Rouse says she's concerned that when the state's new law banning most abortion takes effect in a few weeks, it'll make Indiana's OB deserts grow, with fewer providers willing to move to rural areas.
We knew that there was a healthcare provider crisis even before SB1 happened, and we are worried that it's going to get worse.
Dr. Nicole Scott with IU Health's OBGYN residency program says initial data finds the state's new abortion laws may also keep doctors from moving to or staying in Indiana after they finish their training, expanding the OB deserts even further.
I think that's our biggest fear, in addition to kind of providing comprehensive care for people, is that we are going to make our disparities worse. Right now, we're number 3 for maternal mortality. And with our obstetric deserts, we anticipate that only to get worse.
Indiana's maternal mortality rate is one of the worst in the nation. And the state found 87% of pregnancy-associated deaths were preventable. To turn that trend around, Scott says recruiting and retaining providers in Indiana is key, but says the state needs to do its part to help, too.
We can't change the legislation. What we can do is improve funding for support for maternal health. We can improve our access to contraception. And so these are kind of 2 key areas that hopefully are bipartisan and that we can get continued to support for.
If you need help finding an OBGYN near you, we're going to share some links to help out on WTHR.com. Just go and click on that story.